Mr. Chairman, thank you. And for the record, President Trump has said that he has no intention and would not support cutting benefits to Medicare and Medicaid recipients. Mr. Chairman, thank you for holding this hearing, and thank you to our witnesses being here. I'm excited to start this Congress off talking about how we can all support a healthier America. All of us here have heard many times about the effects of chronic diseases, both on the individual and in the economy. Employer-based health insurance covers about 55% of Americans, with about 72% of employees receiving medical benefits from their employer. This is a huge population and a space where employers can get creative in how they support a healthier workforce. Health is a huge predictor in productivity, and it is in everyone's best interest to invest in and support a healthy population. As a former employer myself, I know what it's like to want the best for my employees and what it takes to offer an attractive benefits package, with health care coverage being one of the most sought-after benefits. Not only does a robust health package give employees a sense of security knowing that they have coverage, but it also gives them the tools to be proactive in their health with access to regular preventive care. I also know that the government and the regulatory environment tend to make it harder on employers to take care of their employees and prevent them from offering their employees a real choice and type of coverage that works best for them. I've experienced firsthand and heard from many small business owners on the struggles they face when it comes to offering a robust health insurance package. The small group market is crumbling, and the cost of offering their employees health care coverage is just becoming too high, and rising premiums unsustainable for both parties. It is our responsibility as the federal government to work with their business owners to understand what is going wrong and come up with creative solutions to fix it. I was happy to see that this was a point of priority in President Trump's first term with the creation of individual coverage health reimbursement arrangements, also known as ICHRAs. The use of ICHRAs has continued to rise, with the ICHRA adoption increasing by 29% between 2023 and 2024. And in fact, 83% of those newly offering ICHRAs were businesses offering health coverage for the first time. That's why I introduced the Choice Arrangement Act last Congress, codifying this type of coverage option into law. While I'm proud that legislation got passed out of the House last year, I'm always looking for ways to improve this idea and help employers take up this option. Mr. Strauss, thank you for coming, and thank you for your testimony and taking the time to explain to us the struggles small businesses are facing when it comes to offering health care coverage. I want to highlight what you said in your testimony about how a one-size-fits-all federal mandate limits flexibility, and the mention of ICHRAs being a good option for employers. Could you explain some of the regulatory barriers that small businesses are seeing when trying to offer ICHRAs?
Yes, thank you for the question. ICHRAs are a great tool, and I think the more we focus on options, regardless if that's individual or employer-based situations, options are the key here. So we want to stop taking things away and continue to expand the things that we do have. ICHRAs, right now, one of the biggest challenges that we see with some of our employers is it's one or the other. So if you're going to go ahead and put an ICHRA plan in place, an employer has to contribute at a pretty high level to offset subsidies in the marketplace. And so an employer doesn't want to do something that's going to actually disrupt employees' coverage and access to affordable health care. And so what I think would be a really great solution there's tax incentives. I know Indiana has started to put tax incentives for employers that are offering ICHRAs. And then some sort of an offset. So for instance, if they've got an employee that might receive a $350 subsidy through the marketplace, but really that employer is only able to contribute $200, they can actually contribute the $200 and then allow that reduced premium tax credit on the government side of things. Today, if they only contribute $200, that member can get no subsidy through the marketplace. And so you can see how sometimes that's challenging for employers, especially small employers, because these are people in their communities that they're trying to take care of. So I actually think we would be able to find a bigger space for them if we had some of these other regulatory changes to the ICHRAs. I know that most employees want their coverage through their employer. That is the second thing that any employee comes when they're coming and looking for a job. It's their pay, and then it's benefits. So a lot of these employer benefits, the premiums are the same in the small group market as they are in the marketplace. and the marketplace provides a subsidy where the employer is trying to compete with large employers, their premiums are twice as much as a large employer is. So it really makes a very uneven playing field for those small employers to continue to contribute to their communities, but then also compete in the market today. So again, I think ICHRAs are a really great place for us to expand and just continue to offer options and choices for people.
Thank you for your expert testimony. I really appreciate it. I yield back.